everyone. Welcome back to Crowning Connections. Our guest, Lauren, from this first episode, we wanted to bring her back and to share a little bit more story and a little bit more of the technical parts of her health journey.
Hey everyone, thank you for joining us for part two of Lauren's story today. And we are thrilled to have her very good friend and lymphedema therapist, Andy, with us today. So I'm going to let Andy introduce herself and tell you a little bit about her and what she does. And then we'll kick off the questioning and make sure that we can let you guys know what this lymphedema stuff's all about before this episode ends.
Hi, everybody. My name's Andy. I am a physical therapist and a certified lymphedema therapist and wound therapist. I've been doing lymphedema for over 12 years now and been working at a variety of hospitals here in Richmond and had a chance to get to meet and work with Lauren. So I'm here to shed a little bit more light on lymphedema.
And we're so glad that you're here. And Lauren, on that note, do you want to start off and tell our listeners about how we first started to recognize something was going on with your legs?
Yeah, so back when I initially went down and was unable to really move around, I started noticing these little bumps on specifically the bottom of my right leg. And I noticed every now and then they would fill up and drain. And that's what started the battles with cellulitis multiple times. And so we're dealing with this for almost a year. And we I start realizing like the skin on my legs is really tight. It's just there's no room for my legs to grow anymore. And it was in rehab that their doctor said, I think you have lymphedema. And I said, huh? What is that? And they're like, I think you should go to the lymphedema clinic. And so they referred me to Bon Secours, which is where I met Andy. And I started working with her. And she's like, yeah, you have lymphedema. It's stage 3. And I was like, I don't know what that means. And so she's like, well, we got some work to do. And so through that, like I've learned what it was, how we can manage it, and the steps that you can take at home, but also with a therapist like Andy to treat it. So with that, I'm gonna let Andy explain all those
So
things I just said.
Yeah, so it's with what Lauren had. She is a stage 3 lymphedema patient. The spots that started on her leg were a mix of what we would call lymphocutaneous cysts and papillomatosis. So those are two side effects of chronic swelling. The the skin starts to weaken, and you end up developing these little bumps. They kind of look similar to blisters, but if you nick them, you cut them, you try and scrub them off, they're highly vascularized, meaning they have their own blood supply and they'll bleed. And then it leads to lovely things like a cellulitis infection and can cause somebody to go into sepsis. So as a lymphedema therapist, we're working on doing something called complete decongestive therapy. And it's a program where you work with a certified lymphedema therapist. You come in, you get your therapy. It's typically a 90-minute session. And we work on a specific type of massage called manual lymphatic drainage. And we work on placing people into compression to help move fluid from the legs or arms or the impacted area that they have. And then we talk about a lot of skincare and education for all our patients so that they understand how to manage this condition. And then we work on some general exercises. It's not hardcore training. It's more gentle exercises to kind of get your lymphatic system moving. but we will work together until we get her into some custom compression garments is what we're going for. And then as she goes along and learns how to manage this on her own, we'll do regular check-ins and she'll come see me every once in a while to get updated garments as she progresses through. So, yeah.
So on that note, as you know, Andy, we were told early on that those little bumps were folliculitis. And I guess as it turns out, this whole year plus, those are just getting worse and our skin's getting worse. And so for listeners that may not
Certainly.
understand or know what lymphedema is, can you share a little bit about like what it is and what causes it?
Sure. There's a multitude of causes for lymphedema. There's two separate categories of it. One is a primary lymphedema, and those are people who are born with some sort of genetic component with it. They're missing part of their lymphatic system. And then the more common one that we see are secondary lymphedemas. Lymphedema is an issue with your lymphatic system. It's been damaged in some way. It's suffered some sort of a trauma. But our lymphatic system is basically like the trash collectors of our body. Our blood circulates through our system and it drops off all the nutrients that our skin and our body needs to function. And our lymphatic system comes through and is supposed to clean those extracellular matrix stuff, proteins, water, all sorts of stuff. It's supposed to pull it back and bring it back into our body so that it can circulate and get out. And unfortunately, with people with lymphedema, that system's not working. So often, what ends up happening is the protein molecules in your body, they tend to collect in the areas, and in Lauren's case, it's in her legs. They collect there, and protein loves water, and so it pulls more water, and so you start to swell. So this the thing is, people often ask, well, I should stop eating protein. I don't need more protein. No, that's not the case. Our bodies have protein and need protein to survive and do the things that we need our bodies to do. So it's more this type of massage, which research has shown when we do this manual lymphatic drainage, we are able to speed up our system, its function up to 6 times its normal rate. So it really gets it moving. And then we use the compression as an external force, something to help push the fluid out from the involved areas. So, um, we also got Lauren a vasopneumatic compression pump. It's looks like a giant snow boot.
It
And
does.
it's connected to a machine, and it's supplemental. It's to help her manage it long term too. But these chambers also fill up with air, and they do it in a specific sequence that tries to mimic what we as the therapist will do in our manual lymphatic drainage. We also have taught both Lauren and her husband how to do the massage so that she can do it at home and be more effective at managing her care.
And Lauren, on that note, do you have, with regard to the lymphedema, are there challenges or difficulties that you find trying to cope and manage your care at home, or do you feel like it's not too bad and you've pretty much got that under control?
There were definite difficulties at first. Yeah. Andy was a sounding board for a while, as well as therapist. It is compression in and of itself is difficult to get in and out of. And so we started with a sleeve. Would that be the right term?
Yeah, it was a light grade compression. So when we first start, we want to be careful. Blood flow is important, and if we start really aggressive, we can cause our patients to have other side effects or injuries that we don't want them to have. So we started off with something that was in our area, it's a disposable compression sleeve. It's just something that we cut, put on her, and it's useful for about like a week or two. The specific type that she had lasts a little bit longer, a couple weeks, but it's nothing permanent. Like,
Yeah.
like it's very, very light.
So we started with that, and that was not horrible. But the process to get into the reduction kits in and of itself was not great. Not great. And took a pretty long time.
Yeah.
And those are just specifically, and that, it would vary from patient to patient. But for me, they are, especially at first, painful as we go into them and we're adjusting the compression throughout the day. And um, frustrating at times. I've worked very closely with Andy for probably a couple months now, trying to figure out these thigh pieces will not stay up. How do we fix this? What do we do? And so there's, it can be frustrating. I do need help still getting into the compression pump, but let me tell you, it's my favorite thing ever. I love it. But navigating, I think, lymphedema and all of these things. So it's like therapy twice a week, an hour and a half at a time, compression garments, pump every day for an hour, all of these things. And in my case specifically, we've struggled with being able to compress my feet. Um, my toes turn blue and get cold. And Andy actually was like, let's get you an ABI test. Um, and so what that does is they put like a little blood pressure cuff around your ankle, and Andy can explain this better after, but they put like the cup around the ankle and they're testing the blood flow. And so we did that, and I went back into lymphedema and I gave Andy my paper and she said, mm, uh-oh. I was like, I don't like that face. And so we learned like we can't compress my feet at this point. And so now we're trying to figure out, well, okay, we can compress everything else up to the abdomen. What do we do about the feet? And so it's just been a process of like really relying heavily on Andy and for any questions I have and things we need to do at home. But then also James to be able to get me in and out of the compressions and in and out of the pump. And so it's just been an interesting journey. And I'm like, super, I'm going to say this a million times, I'm sure, super thankful for Andy. She knows this. Like, I would be lost in this journey if it weren't for her. But I think every journey is different. But for me, it's been a mixture of frustration and okay, now that we're getting compressed and we're losing fluid, which I've lost a significant amount of fluid, um, the pain in the legs goes down. And there are still bad days, but for the most part, it's better than it was.
Yeah. She the specific test that she's talking about was it's an ABI. I also requested a TBI. It is those all stand for ankle brachial index and toe brachial index. Those are specific tests to check the blood flow in her legs to make sure that she's getting adequate um blood supply to her legs. So that's a concern that we have as therapists, is that we're not compressing so much that we're cutting off circulation to kind of important body parts. So, she went out and had this test done. There are specific ranges that as therapists we are aware of, what is safe to compress. Her tests, I've sent her out for, more, testing so that we are safe when it comes to it, but as of right now, she's absolutely right. The purple cold toes is not something I like to see. So, getting her into a garment that is gonna keep her contained, um, as well as be safe for her, that's important. So, right now we're in the process of getting her referred out to some good physicians. Right now, the next step is for her to see a vascular physician, a vascular surgeon, just to make sure that there's nothing that they need to do on their part, and get the clearance to go forward with some further care for her. So yes, lots of components come into play. We've done a lot of different things. We've had fun with kinesio tape as well. So you watch any sports, you watch the NBA, you watch swimmers, you watch football, you see the guys all taped up with the black tape. Yeah, we use that too for a different purpose. We redirect the fluid. So we've done that. She's done the pump, she's done exercises. She's changed her diet a little bit. We're avoiding salt-based foods, eating healthy, right? So, yeah, we're getting closer and closer. She's making pretty significant strides. And yes, reduction kits are tough. It's a Velcro compression garment that she is able to manage with her husband on how much compression is comfortable for her, but it's still effective at moving fluid from her legs. So,
And then when she talked about how she was reducing, can you explain to our listeners what that means with which she's had to change or you have had to change and adapt those garments multiple times for her because
oh
she's
yeah,
reduced so quickly?
right. So in the early stages of treatment, people come to us and they have this sensation of tightness, of heaviness, their legs. For in Lauren's case, they feel like 1,000 pounds. It's really hard to move them around. So what we do is we take an initial baseline of measurements, and in our clinic, we use good old tape measure, little tape measure, and we go up her leg, the whole leg, every 4 centimeters. So very, very small. And we have a system that will calculate how much volume is in those legs. So we establish a baseline. We say this is what she came in with. And then as we go through treatment, I will frequently remeasure her legs and we put that into the system and it comes back and it tells us how much she has decreased. So you say, well, when do I know when to stop? Her body tells me when it's ready. And that's, we look for something around under about 10% change in swelling. She made some pretty big ones. I don't have that on me right now, but I feel like at one point you dropped like 20% of one leg. So um so she's dropped a lot, and the reduction kits are something that you want to have a therapist helping you with. It's you can get these online. It's a little pricey, but it is something that you'd want a certified lymphedema therapist helping you with, or somebody who's specializes in compression fitting. Um, there are at certain pharmacies and such people that are knowledgeable in that stuff, but I would highly recommend a lymphedema therapist help you. It's a garment that is, like I said, Velcro and has a way to measure the compression that you're getting, the gradient, how strong it's squeezing her leg. And as she reduces, the kit can be pulled apart with it has super strong Velcro, but we readjust it to fit her leg. So as she goes down, the garment shrinks with her. And then we continue each time. It's a process of she has to adjust it every day. And it's not fun. I totally get that, Lauren. I totally get it. It's a pain in the tuchus to constantly keep adjusting the straps. But she's in charge of how fast she wants to reduce her swelling. And then she comes in, we check in it and see if we need to adjust any of where the Velcro pieces are for her. And yeah, it's a process. The thigh pieces are a little hard, mainly because our bodies are not in a cylinder shape; they're more coned. So if you think about if you're trying to squeeze something, it will slide. So we've had to modify her kits a little bit, add some foam, play around with it. And I think we're pretty decent at that right now, right? We're
Yeah,
getting-
yeah, we're good.
yeah. So
You mentioned a couple of things. One is that she had stage 3. Could you just share what the different stages are and what they kind of mean long term? And then, second question is, this is a process and it's a journey. So, like, typically, if you saw somebody who had stage 3, how long does that normally take for them?
so to answer the first question, there are there's 3 stages, but there's technically 4. There's, a stage 0, which is often somebody who's had a trauma to their lymphatic system, but it's not visible. They don't notice anything. So these would be more, um, cancer patients who have gone through radiation, chemotherapy, surgeries, and they're not swelling. They're not having any side effects right off the bat. So those are stage ones. Stage 0. Stage 1 is a person who you'll start to notice swelling during the day, and then you go to sleep at night and you wake up in the morning and you're back to normal, but you continue up on your day and it's this constant cycle of swelling that disappears. Stage 2 is when you're starting to notice you're swelling during the day, you go to bed at night, and you wake up in the morning and it's not quite back to where it was, but it's also not the biggest it's been. So, and you start to notice a little bit of texture changes in your skin. It's not as soft or, you know, squishy or, it's not the same feeling that you feel on when you are touching your skin on other places. Stage 3 is where, you've got more of that what we call fibrosis, or, brawny textures of skin. You're part of what the lymphatic system's supposed to be managing is like collagen, and the collagen that sits in your skin starts causing texture changes. So these are the ones that you swell. You go to bed, you get like a little bit of reduction. You wake up in the morning and it's still not there. You look at it and you can just go, "Oh, that's swollen." And it's not going away. And it just progressively builds and builds. So it's just a step up. Also, if you develop wounds, that's the more common stage that you're going to see the wound formation. Your skin gets further and further away from its blood supply. So we talked to Lauren about this, but any nicks, cuts, bumps, that puts them at such a high risk of developing wound because you think about blood supplies here and your skin's here normally, let's say, and that's the distance it's traveling. As it gets further and further away, it takes longer and longer for your body to close those wounds. So, those are characteristics of a stage 3 lymphedema diagnosis. And then the other question that you had was long-term prognosis.
Mhm.
So understanding that lymphedema is a lifelong condition, unfortunately. Once you develop lymphedema, you have it. um, Unfortunately, our lymphatic system does not regenerate like other parts of our body, i.e., like skin. Our skin cell, our nails, fingernails, they're always growing. Um, but our lymphatic system doesn't. So there's a lot of um, providing mental health support too during this process because it's almost like getting a diagnosis of MS or ALS or something like that. It's something that they will not have a break from. So Lauren's got to stay on top of this. This is not something that she can rest from. She cannot say, "Oh, my leg's gone down. Looks great. I'm done. I don't need to do anything else." So that is a tough conversation that we have during our sessions. Lord knows Lauren and I have been through it. And she's doing pretty well right now. But it's a loss of self, because it's it's not a fun conversation to have, because once you have it, you've got it. There are no cures currently. There are several drug trials in progress, out trying to figure out ways to help improve the lymphatic system. And then there are some surgeries out there that are meant to help. They're completed by super microsurgeons. Lymph venous anastomosis, which is a surgery where the physician's connecting the lymphatic system to your veins. There's lymph node transfers or transplants, where they're taking lymph nodes from one area of your body and putting it where the impacted area is. They have all these physicians have very specific criteria for how they approve it. I am not going to speak any more on that because that's totally their field. But I do know that is out there. And if somebody is interested, as therapists, we work to help facilitate um, contact and let them present their case to the physicians. But this, in terms of management long term, it's something that's Lauren's going to have to deal with for the rest of her life, which means that you got to have a good relationship with your therapist, because you're gonna see them all the time. So, yeah, the course that we're looking at for Lauren is she's getting closer and closer. We'll put her into garments. She knows the massage down pat. She's got the all her tools are there. It's just we're waiting on this compression component, and then she'll go on her own and try it out on her own for a little bit, and then she'll come back to me for checkups every once in a while. So
I think just as her mom and seeing where she was when she first came in to see you, we were having that discussion after the last episode. About how, we believe everything is God's timing. We wanted her in lymphedema therapy the day that she came out of rehab, and as you know, that just did not happen, nor is it realistic with the waiting list and such. But had that happened then, we wouldn't have you, and we are immensely blessed to have you as her therapist. We all just love you. What you've done for her mentally, physically, me also emotionally as mom, it's not understanding what she was dealing with. We knew something was definitely wrong with her legs, but I had never heard of that. I didn't know, and for years we were told, well, it's just folliculitis, go throw some lotion on it. And now we know why. That
Mhm.
was never going to work. It was never going to fix her problem because we were given wrong information. And so Lauren was speaking about how you just have to advocate for yourself when you know something's wrong. As with, she was sharing the tailbone, how you had suggested that she get that checked. And she's like, and I can remember that. I can remember her saying, there's something wrong with my tailbone. I'm in so much pain. And the doctor's like, it's positional. It's because you've been laying in a bed. And that's literally where he left it. So we are
yeah,
immensely grateful for you, Andy. And I know what you're sharing with our listeners is going to be so important, because I feel like probably not all of us even know what this is. Lauren, for you, since you've started therapy with Andy and you go regularly and you're in a couple of different types of compression now, I know we're pushing toward the permanent garments. Um, what have you noticed that's different for you? Any improvements? Where are you noticing changes?
Yeah, I think it varies day by day. With lymphedema, it it really does. It could be great one day and the next day. And Andy can attest to that. There have been weeks where I've had great weeks. I've
Yep.
come in no pain. The
Yep.
legs are down, but there have also been weeks where I'm like, I think last week was one where I was like, I'm like a 9 right now, Andy, like a 9 out of 10.
yeah,
And so it's just, but what was most important for me is I have, and I would advise anyone, not everybody can have Andy, but like I have a therapist who listens. And Andy, like she picked up on that with the tailbone. When I said burning, she immediately stopped and said, "It burns." I was like, "Yeah." And so she pays attention to what I say, not just when it's bad, but when we're just talking in general. And so having her there to say, okay, well, where are we feeling the pain? What does it feel like? And then she's able to say, there's been so many times where she's been like, oh, I bet it's this. And I'm like, what? I didn't even think about that. And like, one of the bigger areas for me is my upper thigh, that like brawny skin that Andy was talking about. I have that on my upper thigh. And I'd be like, Andy, it hurts. Like my upper thigh hurts. And so she would come over and, she's checking it to see how it feels. And she's like, what happens is a lot of times it can fold over some when it gets that brawny. And mine does. And it feels like it's that brawniness that almost feels like it's stabbing my leg. And so it's easier. It's hard, to have to deal with, but it's easier when you have a therapist who listens to you and who also advocates for you. So I don't only advocate for myself. Andy advocates for me as well. And she was instrumental, especially in the compression garments. That was a fight, Andy can tell you, for so long.
Yes. Yeah, there's the compression battle, I think, is a frustration for every single lymphedema therapist in the US right now. It's it's not fun, but yeah, working on getting the compression for you was a trial.
It was a battle, and every week it was, "Oh, we sent them out, but they came back," or, "Oh, you ordered the second leg now, so" or full leg versus half leg, so we held the first shipment, and it was a long trial to get into compressions.
Your
You're
your
talking about the compression and your battle with compression and, I guess the shipments and things like that,
Yeah.
they didn't come in or something.
For us, we were consistently in a fight with the company to get the compressions there, but it all goes back to having a therapist who will advocate for you. But Andy was the one making those calls, not me. Andy was the one reaching out, not just with my compressions, but with my pump. And every single aspect of this has been made easier because of Andy. And I think when you're in a situation where, like Andy was saying, you're faced with the lifetime diagnosis, you have to have someone like that. Like if I'm having a bad day, I'm just bouncing it back and forth with Andy, and we're reading the same books. Like
Yeah.
our therapy sessions are just everything. We talk about all the things, and
We got
it's
country
just
music going.
yeah,
Yeah.
yeah, and we laugh or we're mad together or whatever it may be that day. And I think that is important, like that relationship with this person who you're now in a relationship with for a
Yeah,
lifetime.
yeah.
Yeah. Yeah, I think that if you find a good therapist, all of us are trained. I remember going through school and saying, "Why do I have to take psychology? I'm going to be a physical therapist. What is this?" But it totally it makes sense, and is part of the reason why I love doing this job is because Lauren and I are together for 90 minutes. It's a long time, and if you can't form a good connection, then it's a little awkward. But, no, Lauren and I have found good things to talk about, and, there are days when she does come in and I haven't lost anything, I haven't lost the weight, it's not great, what do I do? And it's just step back, look at where you came from, where you started with me, and the progress we've already made, and then I think most of the time, I think I can pull you out of the funk that you're in.
I do. Yeah. And that's it, she's been instrumental, and she's the first one who gets to see the weight because she's doing the weigh-ins, but she celebrates with me. Like the last time she's like screamed and hugged me, and but there's also moments where she instantly knows, okay, that's not what we wanted. Now I've got to get her out of this headspace where, because I do, and I instantly go to, I didn't lose anything. It's not working. But I have to realize, like, it doesn't always happen. Andy told me, she was like, okay, but look, this has been your pattern. You drop off big, gain a pound or two, then you're kind of stagnant, and then you drop off big again. And she's right. You know, I just am like, you're
We've
right,
got
Andy.
that
That's
on recording now, Andy. We've got that on
I
recording.
know.
yeah,
I'm
yeah.
we're
She's
gonna keep this. I've got it. I've got the evidence now.
yeah. But Andy realistically has been one of she's probably my favorite part of my care team, not gonna lie.
That was gonna be one of your questions, and you've already pre-answered it for us. Who was the most influential? Because you talked about having an amazing care team. So who has been the most influential on that part of your journey? And you just answered that for us.
Yeah. Yeah,
And it
I
was
mean,
no
you
hesitation.
know,
I was gonna say
my
it's really
care
because I'm on this right now, so she can't say that it's not me.
no, no, that's not true. I mean,
No,
I
she was
realistically yeah, I have a great care team, but for me, like, I think it's because I work so closely with Andy. I see her twice a week for an hour and a half at a time, and I see Justin is, especially mom has been phenomenal, Dr. CCAT, but yes, I have a relationship with them, but it's different. Like, Andy is in the trenches with me, like,
Yeah.
every session, and so we've just developed, uh, a relationship that I can talk to her about really anything, and, it also helps that we read a lot of the same books, and so we kind of have our, like, own little book club, and we just talk about the books.
Yep.
And I mean, she helps keep me focused and keep my mindset in the right place because I see her so often and she's constantly reminding me, like, this is normal. This is what we're going to do about it. This is how we proceed. But also, she's been my biggest advocate out of all of my care team. Like, really, with like, okay, this is what I think is going on here. This is who we need to see. And so a lot of the things that we found have been because Andy picked up on something that then sent me to another member of the care team.
Andy, back to the mental health portion of this, I think, listening to Lauren just share that, that just plays right back into you. You are a big part of that mental health, her ability to cope and to push through those tough times and those moments when maybe the number's not where she wants it to be. You kind of come back in as her voice of reason.
Oh, yeah. Well, it's they talk about gold standards of care, and one of the things that we've noticed is the mental health component. If you look at what is laid out in the teaching of how they certify therapists, and it's I want to make a point that it's not only just physical therapists, occupational therapists, speech therapists that can get this certification. It can also be nurses. I've seen nurse practitioners. I've seen RNs. There are a couple physicians in the area. There's one at the VA who's a podiatrist. He's got his certification in lymphedema so that he better understands his patients. But a big component is this psychological. We just don't have that set up in this area to do that. So I feel like a lot of times, I know my coworkers would agree that you have to have a certain mental and like almost like a personality. You've got to be able to form these connections and be compassionate and empathetic with your patients. So, um, yeah, the mental component oftentimes falls to me, but this is why I do it. I love seeing the things change. I mean, Lauren, when we broke that one weight, the joy that came out, like that's what I live for. That's what I want to see. that makes my job all the more worth it. So, yeah.
I think that's great. And I do think that there is a huge component and part of that where you two have to get along and, because you are and you have to be connected to a certain degree because you are so close and you are, you know, intimately involved with each other in the health setting. So, yeah, you definitely have to have that,
Yeah.
you know, that friendship connection, all of that, which I think is crucial.
Yes, yes.
So, what would you tell someone, Andy, a loved one, like you referenced James with doing Lauren's massage and helping her get compression on? What would you tell our listeners if there's someone that is dealing with lymphedema? Maybe their family doesn't, like I didn't understand it. I doubt a lot of us do. What would you say to their loved ones about their support or what they can do to help the person in their family that is struggling or that has lymphedema? How can they be a help to them?
Um, I think for them, it's just realizing, I don't know how much Lauren shared how it's impacted her, but just being there for them because it's not something that is, visible right away. For in terms of Lauren's particular type of lymphedema. So um, I think also just understanding that the medical community also has a little bit of work on their part. So in order to support somebody who's going through this, it's really just providing a listening ear, listening to them, supporting them, telling them, this can get better. But it's hard work. And if you're willing to put in the work towards it, it's something that you can manage and live a fulfilling life with. So, um, I know that Lauren has a lot of support in her family and friends, um, that have helped her. So I think that, as long as you've got somebody who's willing to step up and say, "How can I help you?" Because if your loved one is going through treatment and they're working with their therapist, they can always they can help guide you on how you can help them, whether it be like, "Ugh, man, my compression is just sliding down. Can you come give me a hand? Cause it's really tight." Or, maybe can come over here and help me, um, make a healthy dinner or, let's push through doing some of those exercises that you need to do to push the fluid out. Let me do them with you. But it's definitely a supporting role, asking how can you help? Because it's not always something that's very visible.
Well, Lauren, moving forward, do you have any personal goals for your lymphedema that you're working toward or that you want to share?
I mean,
Oh, Andy laughs. She knows something.
Andy laughs because Andy has goals for me
Yes.
as well. So, I think it's just continuing to manage it. Also, well, Andy and I, this might be why Andy laughed. I told her, I was like, I know I'm only going to come see you once a year, but you're not off the hook. Like, we're meeting for coffee. Like, you're stuck with me. And so just maintaining that relationship with Andy, um, and getting into permanent compression garments. That is our next big goal. Um, and that is when we will be at a place where, like Andy was saying, I stop going as often. And so it's hard, I guess, to form a lot of goals because you really never know day by day what the lymphedema is going to do. You can be compressed and still be so swollen that, like, we had that the other day. I couldn't even get my reduction kits to Velcro because I was just swollen. And it was just a bad lymphedema day. But that happens. And so there's no way to tell. There's really no pattern. But just to be in a place where it's manageable and we are continuing to go in the right direction So when those bad days come, we know what we need to do. Or if it's a year down the road, I can call Andy and say, this is a bad lymphedema day. Do I come in clinic? How do we proceed with this? And those are kind of the goals. Like Andy said, this is not anything that will ever go away. So I will deal with this for a lifetime. And so it's just managing it and trying to keep it under control and doing what she has taught us to do throughout this journey.
I think that's important. I think having been there with you early on, trying to figure out, what is going on? Why do these blisters keep popping up, or what we thought were blisters, and why do you keep getting cellulitis, and how are we ever going to keep you from getting this or getting sepsis? And now, so while, like you said, it is a lifetime thing, but now you have the tools and the support system that you need to manage that. So that is a blessing. And thank God for you, Andy. I can't thank you enough for what you've done. You have definitely certainly educated me. I'm sure a lot of our listeners are like, "Wow, I had no idea." I had no idea. But I mean, I see the changes in her, and that is in large part to you and how you work with her and what you've taught James to be able to do to help her at home. So I am eternally grateful for you and what you have given to my daughter. Lindy, did you have any more questions for them?
I don't think so. W- it would be great to see how things progress and then maybe have you both back again to, update everybody on progress. Because that's what we were telling her in the last podcast was, those wins, whether super tiny or super big, should all be celebrated because she's, it's hard work for what Lauren's doing. But I know it makes it easier having somebody like you in her corner that's not only in the therapist role, but it's also in that friend role who can push her and knows how to do that successfully where her mom probably can't to a certain degree.
Right.
you know. But
Absolutely.
thank you both for being here and for sharing. Like I had a little bit of understanding of lymphedema, but I didn't know that there were the stages and things. So that actually was educational for me and, knowledge is power. So now I know and, Lauren's story can hopefully uh, help other people who are in similar situations. So thank you both.
Thank you for
Yeah.
having us. For
Yes.
having me
Thank,
come on
thank
here.
thank you for being here. And if you guys, anyone listening is in the Richmond, Virginia area, there's your lymphedema therapist right there. I don't think I have to convince anyone to go find her. But Andy, Lauren, thank you both for being here and for sharing this story with our listeners. I think it's so important. And like Lindy said, knowledge is power. So just getting this information out there to people that maybe want, especially as you pointed out, Andy, in the early stages, sometimes it's not so recognizable. And so now, who knows? You may have just given someone a prelude to getting some answers for something they're dealing with. So we appreciate that, and we appreciate you taking the time out of your day to join us here. Um, and on that note, thank you guys for tuning in to Crowning Connections again. We appreciate your support. Please like and share. Help us to grow this podcast and share stories just like Lauren's and Andy's with the rest of our listeners. And we appreciate you more than we can say. So until next time, thank you so much for tuning into Crowning Connections and be blessed. We'll see you soon.